The rollout of 7-day-a-week walk-in GP clinics. That's the shiny new policy pledge from the Scottish Government, designed to tackle the so-called 8 a.m. rush for appointments. But the plan, which was announced yesterday at the SNP conference, has been hit by a backlash from the body representing GPs, who say there are several unanswered questions surrounding it. The Health Secretary insisted today that doctors will be involved in designing the system. STV's senior reporter Gordon Cree has this report.
Most of us have been there, first thing in the morning, bashing the phone for a doctor's appointment and it constantly being engaged. And when it does connect, there's often still a long wait.
Thank you for calling the surgery. You are number 38 in the queue.
You've been telling us of a mixed picture.
And then you can wait on the phone for even 20 to 40 minutes.
But today I've been trying to get through for a blood test and I can't get through.
I don't know the others, but here is okay.
My partner, his doctor, I phoned for him one morning. You know, they say phone at 8 o'clock. 8 o'clock, you're number 27 in the queue.
Compared to other people that I've spoken to, a friend in Christopher, for instance, who has a heck of a job, Morningside medical practice is actually very good.
So what's the big idea? John Swinney reckons centres open every day, and later in the day where you can turn up without an appointment will make it easier for us to see a doctor. But Scotland's GPs say addressing workload and critical staff shortages should be the priority.
Well, when I heard the announcement, there were many questions about who is going to staff these centres, how are they going to be set up, who is going to fund the premises. Looking at our calls, it's really for an increase in the percentage of investment that goes into just normal general practices.
This was obviously an announcement at a conference in the lead up to next year's election. It's generated headlines and generated debate, but it doesn't seem at the moment that it's much more than that. This is a kind of back of an envelope idea to get people talking, isn't it?
We have fresh ideas. We are bringing forward those ideas and we're offering solutions to the people of Scotland for the challenges that we face. We do have detail. We know that we're looking to provide 15 centres in this pilot. We know that it's going to be staffed by general practitioners, by nursing staff, and we know that we're wanting this on a 7-day basis from 12 noon until 8 o'clock. Thereafter, we're going to work with health boards and we're going to work with GPs on designing a system that learns lessons from where this has been trialled elsewhere and makes sure that it delivers what we're looking for it to do, which is a flexibility and additionality in the system that beats the 8 a.m. rush and avoids people having to present to A&E unnecessarily. We want to support general practice and being able to continue delivering the services that they do for the people of Scotland, being the bedrock and the heart of our health and social care services.
Talks between the Scottish Government, the Royal College and the BMA continue over GP funding.
We would put money into primary care and we would ring fence that and say to primary care and to GPs, this money is for GP appointments. So that means people will get seen by a GP.
With demand for appointments only likely to keep going up, the question remains whether a line in a conference speech in the year before an election really will ever lead to a significant change in how we can access the health service.
This evening we were joined in the studio by Dr Chris Williams, the Vice Chair of the Royal College of GPs in Scotland. So these walk-in GP surgeries that the Scottish Government are suggesting would create another 1 million appointments. Do you not welcome that?
Any capacity in primary care and specifically in general practice, I guess we've got to look forward to and we've got to be pleased about. At the moment, we're surprised to hear that announcement. We didn't have forewarning of it, so we hadn't fed into some of the thinking that might have gone on there. We might have expected a bolstering of our conventional general practice that we have, the in-hours, the traditional, the normal general practice that people are trying to use. Because within our normal general practice, we don't have capacity at the moment. We need more resource to be put there.
I mean, Neil Gray, the Health Secretary, says he is seeking to improve GP surgeries as well. This is over and above what he's doing there. Can you just outline briefly what your main concerns are about this idea?
I guess with walk-in centres, we've seen some experimentation with this previously in England. So 10 or 15 years ago, there was some analysis of the centres there. Those centres weren't as efficient as normal general practice. And in terms of the analysis of how they worked, there needed to be really careful integration between the local health and social care services that were already existing. And as a college, we're worried about the impact it might have on continuity, for example.
So what would need to be done to make it work then? I mean, the government says they are going ahead with this. They want 15 of them. So how could you make it work?
I guess we need to find out more about what sort of services are going to be provided in these 15 pilot sites. We need to find out how they're going to staff these sites, what proportion of GPs and nurses they're going to use or where they're going to come from. Now, that there might be good reasons to set up new places near where people work, for example, or to cater for people that just can't get to their general practice in normal working hours.
I mean, there has been quite a lot of criticism today from GPs, about the idea, but the Scottish Government says they're offering solutions for a problem that we're facing. I mean, do you accept that there is this problem with this 8 a.m. rush, people frantically getting on the phone, trying to get an appointment and quite often just not being able to get through?
GPs and people who work in general practice are also frustrated with the barriers that people face, and especially when people are needing to make multiple efforts to get through to the surgery, only to find out that the appointments have already gone. But that's a problem because general practice is too full, that there's too much work going on in general practice and not enough staff to do that. There are some ways that we know work in reducing that 8 a.m. peak of activity. So electronic ways to send in requests to see a doctor or a healthcare professional about different types of problem. That doesn't work for everyone, it doesn't work for all types of problem, but there are ways that we can use technology better round about our normal general practice, our in-hours.
But would that be enough to alleviate this problem? Because the suggestion that people would be able to go from 12 till 8 to these walk-in surgeries, I mean, that would give people more opportunity just to be able to walk in rather than trying to get on the phone and get through.
I suppose assuming that they walk in at the right time when other people haven't chosen to walk in. One of the reasons that general practice in hours is so efficient is that we have got a clear idea of what capacity we have. So even though we hit the limits, even though we are filled up every day, that's because we're using every space available. And yes, sometimes people will miss their appointments, but generally we are coordinating the need, the demand with what resource we have.
I mean, do you think there would be enough staff to run these centres?
So my fear at the moment is that we don't know where these staff would come from. So there are suggestions that there are potentially some GPs who are underemployed, who aren't available to get work in their local area. But I don't know that really will stretch to 15 centres in as yet unnamed locations.
But there are more trainee GPs than ever before, isn't there? And I think there are more GPs now than there were 10 years ago.
And I think that people who are coming to the end of their GP training will need to finish their GP training before they could work in these centres. Even then, even knowing how busy general practice is in hours, I think they would still be seeking conventional job opportunities.
Do you think this is political, that the Scottish Government has announced this? Do you think they're doing this in the run-up to the Scottish election to make them more appealing to voters?
Having not seen any details of a plan, it's difficult to know exactly how all of their thinking comes together. There's certainly several problems to be solved here, but our starting point would have been to reinforce normal general practice.
Chris, thank you very much indeed for joining us.